July 2, 1944. Underground hospital cave outside Cherbourg, France. Draped loosely over her shoulders, Dr. Schwester's white medical coat shifted as she stepped from the gloomy depth beneath the earth. Hands lifted in capitulation, her eyes narrowing, unaccustomed to the blinding sunlight she had been without for days. The Americans cannot actually possess the medical provisions they report. This must be a ruse to erode our spirit. These sentences, uttered to her fellow nurses only hours before in the cave hospital chiseled out far below the defenses near Cherbourg, would soon become merely the earliest among many overturned preconceptions. 8 additional German army nurses trailed behind her, emerging into the brightness. They were among the initial German nurses to be apprehended by American troops during the campaign in France. In the last days under siege, they had tended to wounded Wehrmacht soldiers by flickering candlelight, stretching their last supplies of morphine, repeatedly boiling linens for sterilization and reuse. What none among them realized was that, before long, they would observe medical capabilities refuting all they knew about American shortcomings and German dominance. The 9 nurses, seized following their care of casualties in circumstances more reminiscent of ancient surgery than contemporary practice, were about to encounter a healthcare system so advanced and plentiful that it would undermine not only their clinical comprehension, but their entire ideological worldview. Colonel Richard P. Johnson, commander of the 45th Evacuation Hospital at Lamb, regarded them with interest rather than enmity. Adversary medical staff, yet fellow practitioners. In several days, these nurses would return to German-controlled territory under Geneva protocols. In total, 16 German nurses were exchanged on July 2 and July 9. Yet first, they would see American medical practice in 1944. Treatments of which they knew only whispers, surgical procedures beyond their instruction. The emotional effect would endure well past the length of their short captivity. The disintegration had started over a year earlier, on May 13, 1943, amid the suffocating heat of Tunisia. The terms of General Hans-Jürgen Phoneme's capitulation involved not just fighters but thousands of healthcare personnel, doctors, orderlies, and among them DRK-Schwestern, German Red Cross nurses who had supported Rommel's Afrika Korps over 2 years of desert conflict. Captured in this group was DRK-Schwester Ilse Schulz, recipient of the Iron Cross Second Class in April 1943. She was one of fewer than 20 women ever to earn the award during the conflict. Her peer, Dr. Schwester Grete Fock, also a recipient of the Iron Cross in April 1943, maintained meticulous records that would later appear in German military archives. The Americans discard more medical goods in a day than we received over an entire month. They possess remedies we know only as rumors. The scale of that capitulation was enormous. Between 250,000 and 275,000 Axis soldiers, comprising medical personnel from distinguished divisions such as the 21st Panzer, the 15th Panzer Division, and the 90th Light Division. While the majority of apprehended medical staff were male physicians and orderlies, the female nurses would endure particularly deep-seated ideological upheaval. American intake procedures adhered rigorously to Geneva Convention regulations, demonstrating striking efficiency. At designated locations in Tunis, American medical officers categorized detained medical staff within a matter of hours. Those needed for German patient care were kept. Others were assigned for evacuation. Each captured nurse underwent a health screening with tools largely unavailable within the Afrika Korps. By June 1943, the initial batches of detained German medical staff were embarking upon Liberty ships bound for the United States. These quickly manufactured vessels themselves disproved German narratives about American industrial frailty. The onboard medical departments surpassed any facilities those German nurses had experienced at home. Surgical suites with steady electric lighting, working X-ray equipment, and refrigerated drug stores were customary. Most remarkable were the quantities of blood plasma, correctly typed and preserved units that could be reliably transfused, in stark contrast to the dangerous direct transfusions practiced by German forces in the field. The 2-week journey demonstrated American medical perfusion daily. Sulfa power, strictly rationed within the German ranks, was applied freely. Bandages were discarded after a single use. German nurses used to meager portions looked on as American medical staff disposed of untouched food. Waste that would have been inconceivable in the Wehrmacht. Ships carrying German medical workers landed at harbors from Norfolk to New York. Their initial views of the United States contradicted years of propaganda about a nation allegedly hobbled by economic crisis. At the Norfolk Naval Base, medical intake involved thorough examinations for every captured staff member. Dental treatment was given, infections managed, and those who required eye correction were provided glasses. This standard of treatment exceeded what was available to civilians in Germany. The train ride inland revealed one surprise after another. City after city featured glowing hospitals. In Richmond, the trains passed the Medical College of Virginia complex. In Philadelphia, the Pennsylvania Hospital's impressive facade was evident. All metropolitan areas boasted healthcare infrastructure that eclipsed those in Germany's principal cities. A stop in Washington, D.C. saw American Red Cross helpers come aboard to hand out parcels to German POWs, which included toiletries, cigarettes, confections, and stationery. German nurses, schooled in the ideology of racial combat, struggled to grasp such generosity toward foes. Camp Opelika, Alabama opened during September 1942 and received its first personnel from the Afrika Korps in June 1943. The camp infirmary provided a rare setting where German health professionals trained according to Nazi racial medicine worked side by side with Americans who practiced clinical care. This dual personnel arrangement met Geneva standards. American medics directed operations while German staff directly attended to patients. This fostered a situation with few historical parallels. Enemy medical workers functioning within the American military health system. The resources left German nurses in awe. Surgical operating areas included tools they had only read about, such as electrical cauterization, movable surgical lamps, and high-speed sterilization autoclaves. The dispensary contained hundreds of pharmaceuticals stored in climate-controlled rooms, the expiration dates years distant. On July 21, 1944, Glennan General Hospital in Okmulgee, Oklahoma was designated the first German prisoner of war general hospital, with 1,690 beds operated by both American and German clinical teams. Colonel Henry W. Misch instituted an approach unimaginable in Nazi Germany. Unified medical staff learning from each other across battle lines. German nurses from the NSA shaft who had been indoctrinated with beliefs about the inferiority of American medical care encountered a system founded on rigorous scientific principles. Most difficult for their perspectives were the African American nurses staffing the P wards, a result of U.S. military segregation that assigned black nurses to care for enemy captives rather than white American soldiers. German nurses watched these skilled professionals deliver care that defied all the racial beliefs they had absorbed. Nothing showcased the superiority of American medicine more strikingly than penicillin. In 1943, the United States manufactured 21 billion units. By 1945, production had soared to 6.8 trillion units. German medical staff, lacking effective antibiotics, observed regular deployment of this extraordinary drug. At Camp Forest in Tennessee, which accommodated German PSWs and boasted extensive medical facilities, German nurses witnessed recoveries they previously deemed unimaginable. Infections deemed fatal in German frontline hospitals were cured in mere days. Whereas German surgeons would have performed amputations, American doctors managed to preserve limbs. American medical officers, many of whom were civilian physicians in service, freely shared their expertise. Such openness with foes clashed completely with everything German medical staff had learned about both war and medicine. The American blood plasma system marked another advancement that went beyond German achievements. Accurate typing, cross-matching, and preservation averted the frequently deadly reactions from direct transfusions that German forces still practiced. At locations like the 21st General Hospital in Ravenel, France, where German prisoners worked from December 1944. The blood supply system ran with industrial-scale efficiency. Plasma stored over months, shipped thousands of miles, administered with no knowledge of blood types. These were capabilities German medicine had not attained. German nurses educated in the Schwestern shaft were taught that medicine's role was to improve the race. Their curriculum included lessons on heredity and racial science, instructing that weaker patients should be eliminated to strengthen the population. Yet in units like the 12th Field Hospital's facility of 30,000 beds, they saw the reverse. American medical personnel treated German prisoners exactly as they did wounded Americans. POWs received the equal share of scarce medicines, surgeries, and nursing services as Allied military. This essential contrast medicine as a means of universal healing or as a tool for racial ideology began to shatter their ideological beliefs. Christmas of 1943 brought a major psychological effect. American groups sent 500,000 packages to German PSWs. Each contained wartime luxuries such as coffee, chocolate, cigarettes, and soap. At Camp Alba in Oklahoma, which housed Afrika Korps troops, local congregations sang German Christmas songs. Boy Scouts brought handmade greeting cards. Families with sons fighting in Europe sent homemade snacks. The Christmas dinner, complete with turkey, ham, vegetables, and desserts, surpassed anything German soldiers had experienced for years. German nurses wrote of their bewilderment at adversaries displaying Christian compassion while German propaganda called for hatred. By 1944, the Special Projects Branch had introduced thorough educational initiatives. German nurses attended seminars at places like the University of Nebraska Medical School at Fort Robinson. Topics transformed their perspectives: medical ethics, patient rights, and the scientific method in clinical settings. The educational approach itself, which fostered questions, discussion, and disagreement, ran counter to their hierarchical schooling at home. Access to American medical journals brought yet another surprise. Many of Germany's own medical advances had originated from Jewish scientists whom the Nazis had expelled. The internal conflict was intense. As American medical staff were sent to Europe, German nurses began to form a larger part of military hospital personnel. At the 45th General Hospital in Bari, Italy, which began accepting German prisoners on July 31, 1945, they worked under direct American supervision. Colonel Charles A. Pfeffer's hospital treated every nationality the same: Allied military, Italian civilians, German PSWs. German nurses found themselves applying American practices and medicines on patients their ideology had called inferior. The medical technology Americans used seemed generations ahead. X-ray devices, which were rare in Germany, were a common sight. Electrocardiographs, which most German nurses had never seen, were standard. At sites like the 3rd Convalescent Hospital, operational from May through September 1945, German nurses were taught to use equipment they had only fantasized about. Autoclaves that sterilized in minutes instead of hours. Electric suctions took the place of manual ones. Even simple items, such as beds you could adjust, were a significant improvement. Spring 1945 brought the harshest discovery. Footage from concentration camp liberations was shown to German PSWs. Medical personnel who had supported the Nazi regime were faced with the ultimate ethical confrontation. Initial refusal to believe was broken down as the evidence accumulated. Reports from American medical officers entering the camps, photos, and letters arriving from Germany confirmed the reality. They realized they had supported a system that turned medicine into a tool of killing. American authorities addressed this with professionalism, stressing that medicine itself was not culpable, but must never again be used for political or racial aims. U.S. officials began targeted denazification among medical staff. Required lessons covered medical ethics and democracy, using case studies to illustrate how racial medicine harmed while scientific methods preserved lives. Lieutenant Colonel Dorothy Whitman at Camp Opelika set up opportunities for German nurses to observe American nursing methods, with a strong emphasis on documentation and advocating for patients. The clear message was that technical ability alone, lacking an ethical foundation, was not enough. Throughout their internment, German staff were astonished by America's medical resources. Hospitals disposed of recently outdated drugs that Germany could not even manufacture. Tools were replaced at the first sign of wear, not endlessly repaired. This extravagance revealed a truth at odds with Nazi propaganda. The U.S. was able to produce limitless medical goods without conquest. Germany had gone to war to seize what America simply manufactured. American nursing was a direct challenge to the German professional code. The Nazi way demanded absolute obedience. American nurses acted as skilled professionals with real independence. They could challenge orders, suggest new approaches, and make their own decisions within their roles. Such a professional setup was unknown in German nursing and required a complete rethinking of what it meant to be a nurse. Captain Helen Morrison at Glennan explained, "You are responsible for patient well-being. If you see a problem, speak out no matter the hierarchy." This empowerment reshaped their view of nursing itself. The presence of Black American medical staff introduced significant cognitive conflict. German nurses took orders from Black professionals who clearly possessed higher expertise and abilities. Lieutenant Elena Powell, stationed at Camp Florence, Arizona, managed German nursing staff with skill and authority, disproving Nazi racial propaganda. When she improved their techniques or taught new methods, German nurses had to face the errors of their own racial education. The irony was unmistakable. U.S. segregation assigned Black nurses to enemy prisoners. Nonetheless, even this flawed system delivered superior results compared to Germany's racial medicine. Following Italy's surrender in September 1943, Italian medical staff who collaborated with the Americans were treated better. German nurses observed that their former allies enjoyed more privileges while they remained under close watch. This pragmatic approach, judging current behavior over former alliances, differed from the inflexible Nazi worldview. Italian nurses moved freely while Germans who stuck to Nazi principles stayed confined. Even as captives, German nurses acquired medical training beyond what their home country offered. American officers trained them in new procedures, drugs, and equipment operations without reservation. Fire wound treatments learned from the Pacific, surgical improvements from European fighting, were passed on to enemy nurses. German nurses meticulously recorded all of it, knowing they would return to a country in ruins in dire need of medical knowledge. As the war ended in May 1945, American officials finished readying German medical workers for return with extensive instruction. Sessions dealt with public health, disease prevention, emergency medical strategies, and abilities needed to rebuild Germany's health system. They were taught water purification, mass immunization, famine treatment. Colonel Richard Stevens informed them, "When you return, there will be immense healthcare needs. Our training is an investment in a democratic Germany." Training covered how to start clinics with scarce resources, instruct support staff, and enforce health standards. German nurses left with proof of their American instruction, documents that held practical value in occupied Germany. German nurses returning from 1945 to 1946 discovered that 60% of Germany's hospitals were gone. They brought with them not just American methods but a radically new medical mindset. Former PSWs opened nursing schools antithetical to Nazi doctrine, putting patient rights at the center. U.S. procedures were introduced as hospitals were rebuilt. Blood banks were organized after American patterns. Regular antibiotic use followed American benchmarks. By November 1945, as only a few American medical personnel stayed in Germany, the Germans trained in the U.S. system became key in preserving public health. The change went beyond the immediate aftermath. By 1950, many German nursing academies were run by ex-POWs. They inserted ideas absorbed in American detention, nursing assessment, patient advocacy, lifelong education. German pharmaceutical firms started meeting quality controls observed in captivity. Hospitals were restructured in accordance with the American models seen firsthand. The shift from racially driven to scientifically based medicine became irreversible. The figures illustrate the extent. There were 371,683 total German PSWs in the United States. More than 200 medical centers had German personnel. Recorded hours of medical education amounted to over 100,000. The quantity of medical procedures performed reached into the hundreds of thousands. Over 15 nursing schools established by those who returned are documented. Numerous hospitals in the American zone were reorganized following U.S. models. Every trained nurse affected dozens of peers. Each revamped hospital provided care for thousands. The subsequent impact increased exponentially. In 1995, German nurses who had survived American imprisonment composed a declaration. "We served under the Nazi regime and became prisoners of the Americans. We attest that when medicine is twisted by ideology, it turns into an instrument of death, whereas medicine rooted in science and empathy preserves life. The Americans revealed to us unimaginable abundance in medicines, technological advancements, and resources. Even more importantly, they showed us medicine practiced without animosity. They offered medical care to adversaries as patients entitled to the same attention. What we brought back was more than medical skills. We carried a realization that healing goes beyond nationality and ideology, inspiring future healthcare workers. Medicine must never serve ideology above healing. By caring for enemies with humanity, American medical staff impressed this upon us. We entered as prisoners. We departed having witnessed the real calling of medicine. The transformation seen in German nurses during captivity by Americans stands as one of World War II's most profound ideological conversions. They observed not merely technological advantages, but medicine's ultimate aim, caring for all without prejudice. Their passage from practitioners serving Nazi medicine to advocates of scientific medicine demonstrates the influence of lived experience on beliefs. Daily interaction with American healthcare achieved what coercion could not: an all-encompassing ideological shift. The 9 nurses who surfaced from Cherbourg's subterranean hospital on July 2, 1944, symbolized thousands destined for this same revelation. They began their imprisonment convinced of German predominance. They departed understanding medical excellence is rooted in science, adequate resources, and inclusive compassion. This constituted America's greatest medical triumph, proving, through continuous practice, that humanitarian medicine surpasses ideological versions. German nurses were not simply taken captive. They were transformed by witnessing the genuine role of medicine. Through their conversion, the groundwork was established for post-war German medicine to be rebuilt upon humanitarian ideals rather than racial ones. In their metamorphosis resided clear evidence that even those most deeply indoctrinated can shift their beliefs when faced with incontrovertible proof of a superior model. German nurses taken prisoner by American troops realized their former enemies not only had better supplies but a more enlightened medical ethic. They once believed medicine existed for racial purposes. Eventually, they learned medicine serves all of humanity. That lesson gained during American captivity would alter the course of German medical practice for decades. Their account is living proof. Science and empathy-based medicine will always overcome medical practice infected by bigotry and ideology. The prisoners became the ones who bore witness. Enemies turned into peers, and through their metamorphosis, medicine was restored to its rightful aim: healing without borders, scientific practice free of bias, and compassion for every person in pain. On May 8, 1942, the Japanese attempted to invade Port Moresby from the sea, but Allied air and naval forces intercepted them in the Coral Sea. Over the course of 2 days of fighting, the Japanese suffered heavy losses, including the carrier Shoho. The Allies lost the carrier Lexington and had the Yorktown damaged. The battle marked the first time aircraft carriers engaged each other in combat, and neither fleet's ships fired directly at one another. Though the Japanese managed to sink more tonnage, they pulled back their invasion force, preventing the occupation of Port Moresby.